Hi, my name is Lauren. I'm going to be doing the compression wrap practical with my patient Amanda. Before I enter the room, I'm going to put hand sanitizer on my hands. Rub that in. Let it dry. Now I'm entering the room, and I'm going to introduce myself. So, hi Amanda, my name is Lauren. I'm your student physical therapist today. How are you doing?
Good, thank you.
Good. So it looks like you have a compression wrap on now,
Yep.
and you've done this before, obviously. So how did that go the last time?
Good.
Good. So today we're going to be changing that wrap, and it's going to be the same system where it's a 3-layer system. So I'm going to take off her compression, throw that away, clean her wound, and then I'm going to do the new wrap. So then I'm going to come over here and set up my station. So I'm going to put hand sanitizer on again. Try that out. Open my chucks pack, only touching the blue. Open my bag, taking out the 3 layers. This is my cotton layer, then the middle. That layer, the next layer. And then I'm going to get some tape for myself here. Okay, I have everything set up to do the compression layer. I'm going to put hand sanitizer on again. Let my hands dry out. And then put on my gloves. Okay. All right, Amanda. So the first layer I'm going to put on is this cotton layer.
Okay.
It is for protecting the skin from the second layer, as well as evenly distributing the pressure throughout your leg, as well as comfort. So I'm going to take your foot. I want you to keep your foot in this position
All right.
the entire time if you can. And then I'm going to put the roll on. And I'm just gently putting this on her skin. I don't want it to be tight or anything. Make sure to cover it all. You can rest your foot down. Going all the way up to her kneecap. And if this was a problem, if she needed more padding right here, I would add an extra layer at the ankle. But she seems to do okay with this wrap, so I'm not going to. Put a piece of tape on. And then I'm going to grab my next layer, which is the ACE wrap. So this wrap is for active compression. Throw this away. I'm going to pull this up, kind of slid down a little. We just want to get those at the base of the toes. Start with this wrap. Wrapping at the toes. I'm starting a little bit tighter on the bottom, then a little bit more at the ankle, because we want to move that fluid up the leg. And once I get past the ankle, I'm going to start figure 8ing it and letting off some pressure. Most of the pressure should be down at the ankle. Yep, and keep that foot up in that position. Good job. Making sure that it's flat and I don't have any holes. Ground it all the way up to her knee. Get some tape. Get that down. Check it to make sure that there is no holes. Good. This looks good. Okay, now this last layer is going to be our Coban layer, which creates a rigid wall for your calf muscle to pump against, which also helps move that fluid out of your foot. With this layer, I'm just going to spiral it up the leg, not adding much compression to her already compressed wrap. Starting at the base. Thank you. Making sure to cover everything. So I get around here, I can pinch it. It lies flat. You can rest your leg now. Thank you. Come down a little bit. And there's a lot of extra of this, so I'm going to rip it. Lie that down. Put this over here. Put it on. Make sure I don't have any holes. Good. I'm going to check your ankle range motion, so if you want to bend. So you still got good motion. It's not balling up right here. So you can let that leg rest. So now I'm going to tell the patient, so Amanda, with this wrap, if you start to get any symptoms such as numbness in the toes, they start to turn blue, you start to feel any pain that's starting in the ankle and moving up your leg, I want you to take this first layer off, leave the second layer on, see how it goes. If you're still having those symptoms, take the second layer off, but I want you to retry to wrap your leg with the second layer. And if you can't, call us and we'll get you in the next day, because some compression is better than no compression. Okay. Does that make sense? Mm-hmm. Okay, so she's all good. Then I would take my gloves off, throw those away, and hand sanitize again. All right, that's it.